today on how to treat a distal left main perforation with a covered stent. We've got our team here sponsoring the event from Asahi and Biotronic as well. And so what we're going to do is we've got two workhorse wires down. You can see one's down the LED and one's down the circumflex. Let's not pretend that branch is present on the top of your screen there. This is just going to be a typical left main. And so unfortunately, we've had a distal left main perforation that cannot be covered by just deploying in either the circumflex or the LED. It's truly in the distal left main. We do have balloon tamponade at this point, but now we need to actually treat our perforation. So we're going to take a 1-to-1 size papyrus. We'll take that. Okay, so now we're going to insert our 1-to-1 sized papyrus covered stent. So you'll see it coming through. So you see here, now we're going to deploy. And what we want to make sure is that we truly get, so you see how we're hanging into the LED. We're also covering our distal left main perforation here. Because again, if it was proximal to that, we could do the left main, or distal to that bifurcation, we could do the LED. But unfortunately, it's right there at that carina, which happens, unfortunately, sometimes. So we're actually going to deploy right here. And it's important, we have a workhorse wire in the circumflex to mark where that is. Because the big difference with papyrus is we can actually fenestrate through this as opposed to some of the other older stents, which is a little bit harder because this is one layer as opposed to two or more. So now we're going to hook up.
Raymond.
Raymond, you know how to do this. Okay. So now we're going to deploy. So you can see we're very lucky to have achieved hemostasis. So we take a puff, we're good. All right. So now we've deployed our stent, a puff here, very happy, no longer have a perf, but we're covered on our circ, right? So we're gonna be managing this with everything from analgesics to potentially even hemodynamic support, depending on how the patient does. But again, we're trying to save someone's life here. So now we've stopped the perf, but we've got to get this circumflex territory taken care of. So remember, I've got a nice workhorse wire marking where I need to go. Radiographically, this would be even more evidence. All right, so now we've taken a standard 135 microcatheter, in this case a 135 Corsair Pro XS microcatheter, and we performed wire escalation with a variety of wires, starting from workhorse wires to a Xi'an Black, to a Mongo, to a Pilot 200, to a Gaia 3 Next. And the wire that finally crossed was actually a Confianza Pro 12, as you can see here. It's able to cross and fenestrate the papyrus into the circumflex, and now we get a little bit more wire purchase. And once we get a little bit more wire purchase, we can start spinning our Corsair. As you see here, we're now spinning. We're able to fenestrate into the circumflex with our microcatheter seen here. We'll now use this to switch back out for a workhorse wire and move on with plain old balloon angioplasty and or stenting if needed, depending on the plain old balloon angioplasty result from the circumflex into the left main. Thank you guys again for joining us. Thank you again to our partners with Asahi and Biotronic.